It's a pleasure for me to be here today, and I've spent probably over 20 years working in Latin America mostly. So the examples that I'm going to be drawing from are going to be work that I have done or am currently doing in Latin America that have started with English-based surveys or survey instruments. I'm also going to spend a little time talking about survey design, questionnaire design, and some issues around administration, because those, in fact, also have very culturally relevant aspects to them. And so let's get started. So some takeaway messages are that the former gold standard of this forward-back translation was the only thing you had to do, really is no longer sufficient to make sure that researchers are able to tap into the truly salient cultural realities. And in fact, just the simple forward and back translation, which isn't always simple if it's not your language, can also be sources of error, both random and systematic error. And as survey researchers, we're always interested in trying to reduce error, right? So at every step in the process of developing a survey and a questionnaire and implementing it, we want to look for opportunities to reduce or minimize the effect of either random or systematic error, which can get us off the mark of finding the true population mean. So that's something that is important to us. For those who may not know the standard of forward and back translation, is you always want to find somebody to translate into their native language. So if I'm working from an English questionnaire and I want it translated into Spanish, I'll find somebody who's fluent, bilingual, hopefully, but whose native language is Spanish. So they'll translate from the English to the Spanish, and then I'll find a native English speaker who's bilingual and can translate back. That's where the back translation comes, from Spanish back into English. And then you compare the two documents to get some sense that you've, in fact, hit the mark. That's how you translate the words. How you translate the context is what I really want to spend some time talking about today. Which brings me to the second point here, which is that translation of items, the individual questions in your questionnaire, should follow the same principles that guide the development of the questionnaire in the first place. Because in fact, when you're translating a questionnaire, you're writing it, right? You're writing it in the language in which it's going to. But it's going to be read and understood by a different culture than the original document. So, having some grounding in the principles of survey design and questionnaire development, I believe, are very important. I think it's artificial and difficult to separate the translation of the questionnaire from the design and implementation of the entire survey. Because, in fact, the way in which the questionnaire was written for the mode of administration that it was originally designed to be implemented in may not be the way in which you're going to be implementing the survey in your study population, because maybe it was originally a web-based survey and you're surveying people who don't have access to the internet, so a web-based survey doesn't make any sense. So all of these components affect each other and are related to what we refer to as sort of this total survey research design framework, which is a framework for understanding how surveys are designed, questionnaires are written, and surveys are implemented, that takes into account from the very beginning to the very end of the process, how have all of the moving parts been connected, grounded in the original hypothesis or study question that we use the instrument as our way of getting at that. That's how we go out there and dig up that information and get that data back so that we can hopefully answer our original study questions. And finally, I'm going to talk a bit about 3 different case studies of work that I have done or am doing now in Latin America, all of which have used required translation. And mostly from English going into Spanish, some from Catalan into Spanish, to Spain Spanish, to Central American Spanish, to then it gets to Colombia Spanish. So we'll talk a little bit about that as well. So, do you not be happy with me as the translator of books of you? I found this cartoon, and I'm sorry I don't know the source, so I'm not able to provide that. But I found this in going through some files and thought it was an appropriate way to remind us that, you know, one of the things that we try to do when we're doing a survey that's a questionnaire-based survey is we're engaging the respondent, right, and giving us information. We need their data. They don't need to give us their data. We need their data. It's our dissertation. It's our publication. They don't need to give us that information. And so they may benefit. Rarely, in my experience, do participants immediately benefit for having participated in a survey. Maybe there's some other incentive that they get where they get referrals or they get some access to information or services that they might not have had. The information they provide can help a class of subjects. So later on down the road, once you've analyzed your data and you've published your results or you've designed interventions that are based on the information you've been able to glean, maybe a class of subjects benefits. But it's rarely the immediate interaction between the respondent and the researcher that results in some benefit to the participant. So one of the things that's important for us as researchers is to be able to establish what's really a social contract of some type, where I'm engaging you and I'm providing you with something that gives you a measure of trust, so you're willing to give me this information. That there's some indication that I have a respect for your privacy. If I'm asking you sensitive questions, I've provided you with a comfortable place where you can give me that information, whatever it is. So the way in which we language what it is we're trying to say really does matter. Now, we all understand the message here is the guy saying, so you're not happy with my work? But the clunkiness of a bad translation can sometimes be another barrier in making that contact with the respondent and being able to engage them in participating fully and feeling like you would understand their answers if they gave them to you in the first place. So I'm going to start with just, I have a brief definition that I thought was helpful about what translation is and perhaps more importantly what it is not. And then I'd like to briefly touch on the steps of designing surveys and get into a little bit about the questionnaire design, because there are cultural aspects to this that are, I believe, shouldn't be separated from the whole process of overall survey design. Then I'm going to talk about 3 case studies. The studies are research that I've either completed or am currently engaged in Latin America. The first is a survey of safety climate that was done in public hospitals in Costa Rica, looking at its association with safety practices and work injuries. I think I mentioned that all the work I'm going to be talking about is work in Latin America, and for the last 20 years I've been working in the field of occupational health and safety. So most of these surveys have to do with looking at workplace exposures, injuries, accidents, ways to prevent disability that might result from the work that people do. The second survey is part of, we are contributing the Central American, Latin American arm of a global study looking at cultural and psychosocial influences on disability. Our focus is on Latin America, and when I present that study, I'll give you a little bit of background on the global aspects of it. And then the last case study is a survey that's still in process, still being developed. We've actually finished the pilot, feasibility pilot in Central America, looking at working conditions and health in the economically active population in Latin America. And one of the interesting aspects of this study is that we have a strong commitment to be able to find workers both in the formal and informal sector. Those of you who are familiar with Central America know that up to 50% of the economically active population is working in the informal sector, which means they're not part of any kind of an administrative system that helps us understand their job tasks and where they work or how they access services if they need them. Here's the definition from Merriam-Webster.online.com. Translation, an act, process, or instance of translating as a rendering from one language into another, also the product of such a rendering. Translation's been around since the 14th century. I didn't know that until I looked it up. It's been around for a long time. We've been trying to take words and put it into another language. And some synonyms, some of the things that help us understand what translation is. It's a rephrasing, it's a restatement, it's a rewording, it's a paraphrase. What I found interesting in the definition were the antonyms. So these are the things that translation is not. It is not intended to be a quotation or a direct quote. So that's, oftentimes I think we think, well, I'm just going to go to Google Translator. And I'm going to highlight this paragraph and I'm going to paste it in Google Translator, and then I'm going to end up with, do you not be happy with me as the translator of books of you? All those words are there, and we understand the general message, but that's really not what we want to say. So this is a framework of looking at the steps in designing and conducting surveys. And I hope this isn't too much off the topic, but I'm starting with this because I think that it's really important to look at translation as a part of the whole context of designing and implementing a survey. And these are intended to represent the different stages or steps in designing and conducting surveys and looking at how interconnected that they are. And first, we start with the topic that we're looking for, and we've defined our objectives. So this is where we've articulated our study question. And then we go through this process of matching the survey design to the objectives. We're defining our different variables, we're drawing our sample, we're formulating our questions, we're actually formatting the questionnaire, whether it be print, electronic, to be self-administered or interviewer administered. We're thinking through the relationship then of these variables, because at some point I'm going to have to analyze this data. We choose methods of data collection. What's the best way to access the population that I'm looking at and engage them and draw them into being willing to participate in my study? The carrying out and the actual administration of the survey and monitoring of the data collection, preparing and planning for and actually implementing the analysis, and we finally get to writing up our findings. So in looking at these steps of designing and conducting surveys, I thought, which of these steps are really grounded in the norms, the traditions, the culture of the study population? And the yellow boxes represent the ones that, at my glance of this, I think really have cultural implications. Certainly the objectives and the topic of the survey has to be relevant to the population you're studying in the first place, right? Formulating the questions, and we'll get into some of the case studies, we'll see some specific examples of that, but formulating the questions, formatting the questionnaire, choosing the different modes or methods of data collection, all of those have to be appropriate for our study population. I can take a study that's been, that has, Cronbach alphas of 1.0, can be perfect, and can have lots of validity tests and other strong statistical significance in its original language. And if I poorly translate that questionnaire and I administer it in a way that is a mode of survey administration that doesn't make sense with the study population, there's no telling what kind of error can actually be introduced as a result of the respondent not understanding the questionnaire, the method or the approach to the subject being off-putting in a way that they're a little more guarded. So we want to make sure that when we translate the questionnaire that we understand all of these other component parts, because that's what you have to bring onto the paper of the translated questionnaire. While I was finding cartoons, I could reference this one. This is from the New Yorker. So when we look at trying to articulate a question and a thought clearly, here's a survey researcher at the door, and he says, next question, I believe that life is a constant striving for balance, requiring frequent trade-offs between morality and necessity, with a cyclic pattern of joy and sadness, forging a trail of bittersweet memories until one slips inevitably into the jaws of death. Do you agree or disagree? Obviously, there are a number of things wrong with this, so you wouldn't want to just translate it. But the point that I'm trying to make by bringing this into the presentation is the even-handedness with which we phrase our questions, right? We need to really stick to make sure that the question itself represents one concept, that it uses simple words, that it's as short as possible so that it can be understood, but it's not garbled with a bunch of different phrases that can distract the participant, the subject, into really understanding what the survey is about. So looking at some of the cultural aspects then of this framework of survey design. I think it's important, as I mentioned, that when we get ready to do the translation, that we're still grounded in the principles of questionnaire design and good survey research. So researchers should start with a culturally clear idea of the concept they want to measure. We'll talk a little bit more about that with specifics with the different case studies I have. But if you're taking a study that was an interesting idea in a very gringo population, and you want to see whether that study makes sense in your Hispanic population, or you want to compare countries in a region where, everybody speaks Spanish, so what the heck, we'll just translate it once and use that same survey. You know, the concepts that you're trying to measure have to make cultural sense in the population that you're trying to measure. So you need to know as much as you can about your study population and the context in which you'll conduct your survey, which you've probably done before you started developing your idea. But if you're taking another work, and many of us we build better mousetraps, right? We take somebody's survey and we improve it and we adapt it and we modify it. But it's more than just translating that instrument into another language. It's about making it culturally appropriate as well. The phrasing of questions is what operationalizes our concepts of interest and should also reflect the level of measurement. So that question that the interviewer at the apartment number 7 was giving, he really wanted to know if they agreed or disagreed with this, with what? You know, it was hard to know what he was really asking you to answer. And so how we phrase the question, and remember one of the definitions or synonyms for translation is rephrasing. So we're taking a phrase and we're putting it into another language. That's how we operationalize our study variables. That's what sort of makes them come alive in the population that we're working in. And these concepts need to be culturally appropriate and accurate. So work that you do getting to know your population before you do your translation is as important as the work you do after you've done your translation to pilot test and do some cognitive interviews or whatever techniques you're using to see whether you've actually translated it correctly. Because the way in which the population you're working in now may think of these things may have an effect or an impact on the way in which you would actually operationalize that concept, right? Obviously, the format and order and the cultural context in which questions are asked are important. A questionnaire is I look at a survey instrument, a questionnaire, as a dialogue. It's a dialogue between you, the researcher, and the subject. It should be clear to me early on in the initial set of questions what it is you're asking me to do, and I should have some sense of why it's important. Don't start with my age, my income, and my education level. Put demographics at the end. It should be, so it's this process of this dialogue where you're sort of helping the subject tell you their story. So the format and the order in which questions are paired, and this gets into scale development, which is beyond the scope of what I'll talk about today, but how we combine our questions so that they make sense. The sequencing or the order in which the questions are asked is important. And then again, remembering the cultural context in which we're asking questions. In fact, we found that the levels of measurement that we used, we still ended up with a Likert scale, but we had to change the labels for the Likert scale. We couldn't just do the translation, because the translation of the different labels of the 1 to 5 point Likert type scale didn't make sense in the population that we were studying, and we didn't find that out until we did some focus groups and some pilot testing, because some of the labels referenced normal or usual behavior. Well, I mean, even in similar race and ethnic groups, you can find a lot of variation in what's normal and what's usual. So I'll give you some examples of that when we talk about the case studies. So again, the format and the order in which these questions are put together in your translation also matters. There are a number of statistical tests available to you, and I believe the speaker this afternoon is going to talk about some of the different ways in which you can assess whether there's good consistency and reliability of your translations, what the predictive validity is, so that you can test whether in fact your translation bore out your original assumptions based on what you know from the literature, or that there's good consistency. Maybe you do a pre and post test. There are a number of techniques available for statistically evaluating the accuracy of your translation, and they're important to consider. Web questionnaires require special consideration, and depending on the population that you're working in, that may or may not be feasible based on their access to the internet, how versatile they are with it. There are some study populations where that's the best way to reach them because they never open envelopes. They'll only work by email or internet, and it's a great way to get a survey done. The design issues are a little different with web-based surveys, and there's some great reference books out there. Don Dillman has a wonderful text on mixed mode surveys, mail, internet, and web-based surveys that can give you some good hints. So web questionnaires do require special consideration. And finally, the different modes of data gathering present different cues to the respondent and can affect how the respondent proceeds with the questionnaire. So if you're showing up at the door, and there are some cultures where household surveys are acceptable, they're part of the cultural norm. There are some societies where census data is collected on a regular basis, or political polling is done, and it's done door to door. It's often a way in which information is shared in communities that don't have a lot of access to telephone or internet. So depending on the population that you're studying, different modes of communication with them and the way in which you get them connected to your study will present different cues to them in terms of how they go ahead and answer. And certainly in an interview-based situation, you want to make sure that the data collector, the person who you've got actually collecting your data for you represents your study in the most appropriate and culturally appropriate method as possible, so that there's no embarrassment that might be provided if you're asking some sensitive questions. This gets back to this idea of a social contract that we get into. When I come to you as a researcher and I want to engage you in my work, I'm bound to provide you with some protection, with some assurance of what I'm going to do with your data and how I'm going to treat that data, with some clear understanding of what you're going to get out of it, including maybe nothing. And is there some other way in which I can appreciate you? Is there a token that I can give you that might say, you know, I appreciate the fact that you took the time to answer this survey? Or is there other real pertinent information or value that I might be able to provide by a list of clinics, or you know, a token for, I don't know what, taxi to go to a clinic, something like that, depending on the topic. So as we look at translating questionnaires, we're looking at taking words in one language and translating them, rephrasing them, restating them even. It's important to remind ourselves of what it is we're asking the respondent to do when we create a question in the first place. And there are 4 main stages that the respondent has to go through when we engage them in answering a survey. First of all, they have to understand the question. So it has to be written in a way that makes sense to them at a language level that's appropriate to them. They then have to retrieve some information. You're asking them a question and they have to retrieve information. And that process of retrieving the information becomes more or less difficult depending on how complicated or complex your question is. Are you asking them to do a lot of math, or a lot of figuring out, or a lot of remembering? What are the ways in which you can make that easier for them by providing some time reference or some kind of cognitive tips that can help them actually answer the question? And then they go through the process of coming up with the judgment about what's the appropriate response, right? We all know as survey researchers that one of the limitations of survey research is that there's a social norm in many cultures to want to give the socially correct response. So we want to design our survey in such a way that it's comfortable for people to tell us the truth, whether that means providing them with a more private area or asking questions in a way that there is no apparent judgment in the question itself, that you're just asking them for responses. Whatever you can do to help make that process of actually answering your question easier. And then finally there's the answering of the question. There's a framework that can help us look at the different stages that a respondent goes through when we actually design a questionnaire, and I've got that into the next slide. And I'm hitting this hard because I think that these sort of fundamental basic principles are very important to keep in mind as we go about translating the questionnaire. So we're not only making sure we're just stating the question correctly, but that we're stating the question in a context that makes sense to the culture, that reflects an understanding and respect for the population that we're interested in studying. And if we look at these different elements then of this framework for evaluating how we go through the process of reading, understanding, and answering a question, these criteria can be different in different cultures, right? They can have different sort of consequences or ways in which the words are made clear. Certainly ways in which the response format that we provide makes sense. And I mentioned one of the case studies we'll get to. We ended up changing the response format because on the basis of the input that we got from the study population, because the original format that we had translated by all these wonderful experts still didn't make sense in the cultural context in which the study was done. Instructions obviously have to be useful, and again, I've mentioned the order and context in which the questions appear. And you need to consider whether there's going to be any kind of a response effect based on the different mode of survey administration. And there's some good literature out there that combines different methods of survey administration. Self-administered compared to interview-administered compared to web-based. And so I'd encourage you, if you're thinking about a mixed mode survey, to consider becoming familiar with that literature. Before I go into any of the case studies, any questions or comments or experiences that you've had as researchers of what I've been talking about so far? Yes?
When you're translating, I don't know, you always try to keep the same meaning without looking in the old way that you mentioned, translate, back translate.
Which is where you've got to start.
Which is, yeah. So errors can be shifted, can be carried along to the translation. I know that in a big study I worked on, there was one question where in the depression section, how many times this week did you feel on top of the world? Okay, so that's a phrase in English.
Mm-hmm.
So when it was translated to, what was it, Cracima de Deus, I forget, I think I'm speaking Portuguese, but it came off as above everybody else, was the meaning.
Mm-hmm.
And so, and I'm like, and as soon as, and we didn't even discover it because we were just translating, back translating.
Yeah.
So you're going to have this one question that you have to throw out.
Right, exactly. Well, thank you for that. I mean, that's a great example of, particularly when you look at idioms or expressions or slang, and that's why if you look at some of the principles for actually writing questions, one of the things that we often say to students of survey research is make the question short, simple, use little words. And now, top of the world, obviously, those are all small words. But the point being, don't try to be fancy and over-explain yourself. Try to be as clear to the point as you can. And then yes. Mm-hmm.
And then I had a follow-up. And in doing this, do you think that is it better to shape? You know what the English is trying to say. Is it okay to shape the translation so that it's saying the same thing but in a culturally appropriate way?
That's the whole. I believe that's the whole point.
Yeah. Okay. Because I feel like I have a Spanish and an English version I've been working on. And it seems like the Spanish version is better written than the English version.
Well, and in some cases, we've actually had to split questions because in the English, you could phrase it in a way that it was understood as one concept, but when it was translated, it became two. And that's a bear if you're trying to compare data sets, right, English to Spanish. But that's where I think the work before you do the translation is very, very helpful. You know, I've done this. I've engaged professional translators who aren't even in the United States. So let alone they don't have any no physical contact with my work or the population that I might be interested in. They've done the translation. I think if you have the opportunity to do some focus groups, just get some way of, you know, getting your finger on the pulse of the community you're trying to research, to ask them how they understand these concepts. Then you get a little, you sort of get a little ahead of yourself, or ahead of the game, if you will, before you actually do the nitty-gritty translation, because you've got that cultural context.
One final follow-up.
Sure.
Does it? I guess my concern would be if you rephrase the question or adapt the question to be culturally appropriate. How does that affect the scoring later? I mean, how would it, like you said, comparing data sets when you have to split the question? But is there any effect on, well, I guess maybe the psychometric properties of it if you change the wording of the question so that it means the same thing, but it in the culture you know what I'm saying? Does it affect,
I think I do, and I think that there are ways in which you can evaluate that. You know, factor analysis is one way of looking at, are you getting the same loadings, if you will, for the different items on the different domains, and those should come out as clearly distinct, identified domains. I'm not suggesting that it's okay to split every question in two when you translate it, but my point was, if we'd spent a little time with the population ahead of time, we probably would have had a better handle on that. And again, you know, we're not necessarily comparing to prior study data. We may be translating a questionnaire that's been used in population X and we want to do it in population Y, and we're not going to compare results. We're going to build on that work, and that's where part of the survey design process has to start with really understanding the literature. And if you're starting with somebody else's questionnaire, get as much information as you possibly can about what's the reliability, did they do any validity testing, how did it hold out over time, was it repeated by anybody else in even another population, is there good consistency and stability of items and measures, particularly also when you're getting into scales. You know, we put together a group of items so that we can kind of get at that latent concept that we're trying to measure. Any other comments or examples of work you've done sort of in this general context of translation, survey design? Yes?
I was working on a study looking at intimate partner violence, and they did the back translation method. So the scale that was written in English, translated into Spanish, and then back translated it. And I think the reason why I bring it up is I think it was an interesting case because when we started to look at the psychometric values of it, the reliability was decent, but then in doing the factor analysis and seeing how the dimensions matched up, they were all over the place for our Spanish-speaking sample. And so to me, that kind of indicated that they were conceptualizing intimate partner violence very differently.
Right.
And just the way that the factors were loaded for the different dimensions. It wasn't even clear how they were really conceptualizing it. So I think that, you know, we thought by just running the psychometrics, we would be okay with saying, go ahead and use this is a reliable measure, but then when it came to the interpretation, we really didn't know what to do with it.
And that's I think a great example of how important it is to understand the cultural context of the study topic, right? Because men and women in different cultures may in fact understand intimate partner violence in an entirely different framework, where it may be not only acceptable but expected. So when you talk about comparing anything to normal behavior, so I think that's a very good example of how important understanding your population, starting with really getting a handle on how do they understand these concepts. And you know, depending on what your intention is, if you're not planning on measuring the English survey data to the foreign language survey data, then you know you have an opportunity to translate that survey so that it serves your interests and the interests of the population that you're trying to serve. In some of the worker studies that I've done, we found that depending on the climate of the organization that we're surveying, there were opportunities for workers to really exaggerate how bad things were at work because they thought that would get the administration in trouble, and they were, you know, unhappy with their jobs, and so they were happy to get the administration in trouble. And so we figured that out in some pre-focus groups, and we made some decisions about how to limit the number of injuries, for example, that someone could report, to set some thresholds, and I'll talk about that a little more in the next case study. Yes, sir.
Just a very brief example. I think sometimes it's just impossible to translate culturally. The context is so big that it's very hard to do this nice, accurate cultural translation that you are looking for. I think it's the right objective, but sometimes it's just very hard to do. So, for example, I have this questionnaire in English. This question that said, "Do you feel part of any community?"
Do you feel part of a community?
Any community, right? Which in the U.S. can be a neighborhood and then improve, but it tells you about identification, right? And we understand that it's a positive thing. But then when the questionnaire was applied in France, the word community means something very different in many senses, and in Spain too. So rather than taking away the question or just explaining it too much, I just left it the same, and the results were very different, but they were productive in saying the different answers to that question show how different the context are. So a partial translation became very productive in this research project in showing how community means something very different, how you can claim a community in the U.S., an ethnic community, but it's something that is an unknown.
Right, and I think you have to make the decision perhaps based on how critical is the understanding of that variable to your study question. So if this is a study about community belonging, understanding belonging to a community, you know, you may need to find some way to tease that out, but it's a perfect example of how there can be great reliability and stability of items across languages of many items, but then there's one item in particular that it's different in France, it's different in Spain, it's different in the UK. Yes?
A lot of things for us when we conduct health needs assessments, how it works with us is when we work together with outreach workers to do the survey design prior requirements, because they provide a lot of insight into the culture of the communities where we're going. So I don't know if you.
Oh, they're perfect. That's a perfect example of how do you access that information ahead of time. Because, I mean, in some ways it's a paradox. I'm doing a survey because I'm doing research to find out something I don't know. But now you're telling me I need to know about the population, that I'm designing a study so that I can find out about the population. So how do I do that? So there are different ways of doing that. Focus groups are one way, but certainly finding people who are connected to the communities, and outreach workers or promotores are wonderful resources for how they're sort of surrogates, if you will. So you may not be able to access your population itself, but maybe you can access key informants or some kind of a surrogate for understanding how the community thinks about the topic that you're looking into. Yeah.
I'll just add a comment. I'm part of the community, and I'm a member of the community that I'm interested in conducting research with. And I assume that I'm from the same background, cultural backgrounds. When I do my questions in the native language, I don't need any translation because I'm the native speaker of the language. And it seems there's also a cultural difference between a researcher and a participant. So the understanding was very much different.
That's a very good point. And researchers often make bad subjects, you know. But thank you for that. That's a very good point. You probably have a great way to access that population to understand it, but to be able to ask those questions to tease out whether there are shared understandings or whether they're different would be very helpful. ¿Algo más? Okay. Okay, so now I'm going to get into talking a little bit about translation processes, the methods we used, and some of the lessons learned from these three studies. The first study is a survey of safety climate in public hospitals in Costa Rica. This study was based on early work in looking at universal precautions in healthcare workers. And as I mentioned, these examples are going to be occupational health and safety based. So our interests were in understanding some of the factors that predicted whether healthcare workers were going to be compliant with universal precautions, which is the set of standard precautions that healthcare workers should follow in the United States when they have the possibility of being exposed to blood or body fluids, right? This came out of HIV/AIDS out of the 80s, 90s, early 90s. CDC came out with this list of precautions that healthcare workers should follow. We were interested, and so there was a series of studies that were done in healthcare worker populations in the United States. And the idea that safety climate, which is really a cultural group level norm, culture being the norms, the methods, the ways in which we communicate, understand, value, right, a reflection of all of those sort of core held beliefs. Safety climate was a reflection of that group level norm, that workers together generated a common understanding of how important it was to be compliant with safety practices. And we were interested in studying that in healthcare worker populations in Latin America, and we had an opportunity to do this in the entire public hospital system in Costa Rica. So it was a great opportunity. That's the other thing as researchers, we, sort of like the bank robbers, you go where the money is. If when you have that access, it's a wonderful opportunity to develop a better understanding of what's going on in HIV/AIDS, and there are 30, 50 different diseases that can be transmitted by blood and body fluids. It's not just hepatitis and HIV. It was very poorly characterized in Latin America at the time. And the other thing that I think benefited our study greatly was that this was a research-naive population. They were not barraged with surveys every other day from some student at the School of Public Health who wanted to get their thesis done. Could you please fill out my survey? So we had a lot of energy and interest, and we got a lot of help along the way from the worker population. So this study was based on previous studies that had been done in the United States. But as I mentioned, these were very gringo concepts, and this was gringo literature. And the surveys had been done many, many times. They had great statistical value, but this was the first time it was being done in a foreign worker population. Our objectives were to identify factors that were associated with safety climate, because our hypothesis was that if you have a good safety culture, you're going to have fewer injuries and you're going to have better compliance with safety practices. And we thought that was a good thing. The hospital system was interested in this study because they wanted to develop a training program that was going to improve the culture of safety in the public hospital system, because they were concerned about their injury rates. They thought their reporting rates were abysmal, which in fact they were. And they wanted the survey data to help guide the development of training priorities to improve safety climate. So we worked out this agreement with the public hospital system where we were going to design a study to identify these factors that was going to be used for developing the future training program. And we wanted to assess the relationships. We wanted to test our hypothesis of whether safety climate was in fact statistically related to work practices or safety practices and workplace injuries. Our methods, this was a cross-sectional study of hospital-based healthcare workers in a very nice sample of 10 out of then 29 hospitals in the country, stratified by type, proportionate to the distribution of workers across hospitals, and we had wonderful access. Before we did the study, we spent a fair amount of time in focus groups with workers that represented a variety of job categories, because this was going to be a study of all hospital workers. This was not a study of nurses comparing them to doctors, comparing them to lab techs. This was a study that was going to likely involve people from maintenance, people from housekeeping, brain surgeons, the transportation truck drivers, the whole bit. So we spent time with as many different work categories as we could to just start talking about this idea of safety climate and how did they understand it, and what was the language, how did they language it, right? What are the words that they used to describe it? While we did work with previously validated scales, that focus group process really helped us modify our thinking about the way in which we were going to try and get this information from the workers. Once we had developed the questionnaire, we engaged experts in the review and pre-testing, and then did the translation and back translation. The original survey then was done in English for this study, translated and back translated. And then we had focus groups, again, and we tried to do this regionally, where we would have some representation from different regions of the country, because we thought that educational level probably was not distributed evenly across all regions of the country. And the cognitive testing really helped us understand whether our response categories were appropriate, whether we offered the right response options, and also how the workers actually understood the questions. This cognitive testing for instruments that are translated, I think, is invaluable, where you sit down with the worker and you have them read the question to you, you have them tell you, what do you think this means, how do you understand or interpret this question, and then ask them, what response would you give? And then that gives you a way of testing out whether the response options you're providing are going to be appropriate. Pilot test is always a great idea if you have the opportunity. We're all bound by time and money, and that's not always possible, but it's really helpful, particularly if you're doing a study in a new population for the first time, to get some sense of what's the rhythm, and what's the energy level, and what's the response rate likely to be, and what are the modes of administration, what are the issues that we need to consider for that. The pilot also gave us an opportunity to evaluate the internal validity of the scales. And when we did that, we realized that in the translation, and remember it's all in the translation of certain items in one of our scales, they had to be negatively worded, so we had to reverse score them to be able to evaluate everything scored in the same direction. And we didn't find that out until we started looking at the Cronbach alpha correlations for each of the scales, and they were great. They were perfectly acceptable. They were, between 80 and 92, and then we get to 68. And it was like, what? How could that be? And so we went through the different items, and that's where we found out that in the translation, they were negatively worded, and so we had to reverse. So pilots are useful for a number of ways. And the pilot also helped us figure out what the response rate was going to be, what the modes of administration were going to be like. Certain hospitals wanted to do it a certain way, and so that also gave us a way of kind of feeling that out. So some of the lessons learned from the Costa Rica study were that the initial focus groups were really critical at the design stage of our study to understanding the cultural context in which our key study constructs were operationalized at a group level. Remember, we were starting with a well-defined, very valid, published, tested survey. And what we did was we took the concepts then and we saw how they worked culturally. And that really helped us as a pre-translation step. The cognitive interviews helped refine the response categories and the appropriate translation of key variables. We found that that the use of some almost slang terms improved the understanding of what it was we were trying to say, and that the higher educational levels understood the slang, but the lower educational levels didn't understand the appropriate word. So things like that, we were able to test that out with the cognitive interviews. The pilot test identified, as I mentioned, the need to reverse score certain items, and it also gave us a chance to look at different modes of administration that we hadn't really considered. The criteria then remained that the third worker population had to have at least 4 hours a day, in a day, of upper body repetitive motion. So agricultural workers, maquiladoras in Nicaragua, call center workers who use their arms to, manipulate the calling devices, etc. So countries got to choose that. The objectives of the study then is to look at prevalence. They want to find out risk factors, and particularly interesting is to explore the risk factors for the persistence of symptoms associated with this disability, and to look at the relative influence of personal health beliefs on chronicity of pain, the extent of the associated disability, and finally to see whether these outcomes vary across countries or if there's some similarities within country groups. So, for example, is the prevalence of back injury among Japanese workers as high as it is in Nicaragua, but the belief that they're going to have back pain in a year and in fact report it is different. Same prevalence, same kinds of exposures, same level of discomfort, but how are there cultural differences that can help predict whether you're going to have back problems in a year, or you're going to have back problems in a year, or I'm going to say I have back problems in a year. It's an interesting hypothesis. We're providing access to the populations in Nicaragua, Costa Rica, and Colombia. The original survey was written in English, and as this is a global study, it's translated into, I think Dr. Coggin is going to get data from 30 countries. I think probably every continent in the world is going to be represented in this study by the time it's done. I'm not sure what the Eastern European country representation looks like, but it's a phenomenal work that he's done. So the study was originally translated from English into Catalan by our friends in Barcelona, and then they translated it into Spanish. And those who are familiar with Spain, Barcelona, they work in both languages, and so we started with the Spain Spanish version, which came from the Catalan, which was the translation of the original English. Well, it's a long way from Barcelona to León, Nicaragua, and to San Jose, Costa Rica, and Bogotá. So our researchers then took that Spanish and through focus groups worked the idioms and the concepts and modified it, and every country ended up making some modifications. And we also, Dr. Coggin had done a lot of work looking at different modes of survey administration to see what kind of impact that could have, because he knew that depending on the country he was working in, some of these would be web-based, some would have to be interview administered because of reading levels. It's a fairly complex, comprehensive survey, and the baseline survey can take a while to get through. And there's some diagrams to kind of help people visualize what part of the body they're reporting pain on. So there was some prior work done looking at the different modes of administration to see whether there was any kind of a response effect, and it was deemed to be stable across self-administered, interview-administered, and web-based. In Nicaragua, The populations that were chosen obviously were the nurses and office workers, and then their third worker population were the maquiladora workers, were women mostly, working in the textile factories, do a lot of sewing, and have a lot of upper body repetitive motion. The surveys in Nicaragua was decided that all of those would be interview administered, which had implications for how big the study team had to be, how long it was going to take you to collect data from 300 subjects, and to be able to find these subjects in a year. In Costa Rica, the survey is being self-administered. They finished the baseline. In Nicaragua, they finished the baseline and the follow-up. In Costa Rica, they finished the baseline. They're getting ready to start the follow-up questionnaire. And in Colombia, they're going to be launching a web-based version of the questionnaire. So we're going to have the opportunity across our 3 little cohorts to see whether what the design effects are for the mode of administration across an interview-based, self-administered, and web-based questionnaire. Some of the lessons that we've learned with the CUPID study is the focus groups resulted in changes in translation of words in all countries, the modismos, et cetera. And there were some important cultural adaptations that were made as a result of spending time with these worker populations. The first was that in Nicaragua, the question about race, nobody knew how to answer that. How would you describe your race? Well, what do you think it is? So we changed that to nationality. Became sort of a way of saying, you know, are you from Nicaragua? Are you from Honduras? Are you from El Salvador? Where are you from? Another interesting anecdote that came out of the cultural adaptation that we went through with this questionnaire is that the questionnaire was originally written in Europe by Europeans who live in big cities. And one of the questions is how you had to answer, do you, in a given day, do you go up and down the equivalent of, I can't remember whether it's 40 floors, right? And so we get to the focus groups in Costa Rica and Nicaragua, and we're looking around the buildings in Leon, and they're like, there's nothing over 5 stories. And so this was an example of, you know, so how did we ended up having to rescale a lot of climbing of stairs into categories that made cultural sense for the population. Any questions about, Hector, you have a question?
Yeah, this is really interesting. Did you find any issue about this idea of acquiescence, the idea that people try to give you the answers that you want to hear? And sometimes in this type of work it seems like it's not, but in some others, do you think is that an issue here in this kind of work with workers and safety versus just like when you do interventions to say, do you think, did you change your diet? How often do you do that? And so people are more inclined to try to give you the answers that you want. Sometimes. But
yeah.
That issue, is that a big concern that you find?
Well, I don't think that we found that with this study, because we're asking some very sort of basic questions. Does your shoulder hurt? Does your back hurt? Now, some people like to really go on, you know, about the different symptoms and pain that they have. So we haven't had that here. We did find that actually in the Costa Rica study, and I forgot to mention this. In our focus groups, we found out there was a lot of tension in the work environment in the public hospital system at the time that we were doing this study, and the sindicatos were, you know, maneuvering a lot and churning up a lot of energy within the worker populations. And we found that many of them would use this as an opportunity to say, I get 30 needle sticks a month. One a day, that's a lot. And so we rescored the questions. There was a section, you remember that one of the objectives was to look at injuries and compare injuries to safety climate, and to look at injuries and compare that to safety practices. So we rescored it, assuming, we asked for 6-month recall. And we figured if you have one of these events a month, that's a lot. So this is not a survey of counting exactly, it's not a surveillance study. It's a survey to get some idea of whether, is it a lot, is it a little, who's having it, and how are they reporting it. So we set a ceiling on 0 for none in the last 6 months, 1, 2, 3, and then the highest value was 6 or more. And so that was a way of getting at the information we wanted to get at, where we could allow that range of prevalence to be reflected, but it wasn't a prevalence study. Any other questions about either of these studies? Cupid study, the publications are starting to come out now. And so if you, however, I will warn you, I did this the other night, if you Google Cupid, you're going to get more about love and Valentine's Day than you're going to get about David Coggin. But if you then write out cultural influences on, psychosocial influence on disability, you'll get a little more pertinent information. Okay. All right. Then the last study is one that is still in marcha. We're still working on this study. And this is a very nice collaboration with researchers at the University of Pompeu Fabra in Barcelona, universities at University of Texas School of Public Health in Houston, and SALTRA, which is Salud y Trabajo, which is a network of 6 state universities in 6 countries in Central America, all of Central America except for Belize. This study came about as an opportunity to develop a Central American study that would look at the conditions of work and health in the economically active population in Central America. And it's based on a study that's a survey that's been going on now for 25 years, I believe, by the European Union, looking at working conditions and health in the European Union. These surveys provide valuable data for ministries of health, ministries of education, ministries of labor, social security systems, insurance companies, to get a handle on what are working conditions and health conditions of the workers of our country like today. And in Europe, this survey is repeated every 5 years. And if you're interested, look up the Observatory of Working Conditions and Health, or you could just do the EU Working Conditions and Health Survey. And you can actually, it's publicly held data, so that once the data is collected, it's out on a website. Many students and universities use it. It's great dissertation thesis data. And you can look at trends, and it's a wonderful way to do that. So this group of collaborators have been working together for some time, decided that this would be a great opportunity for us to try to do this for Central America. It's a cross-sectional, multinational study that's looking at conditions of employment, work, and health among the economically active population in both the formal and informal sector in 6 countries in Central America. And as I mentioned earlier, the informal sector is very important in this part of the world, because particularly from an occupational health standpoint, these are workers who we don't have access to. We don't have a count on them. We don't know where they go to work because they work on the street corner or they work out of their home. They're not part of a reporting system. So when we want to get a handle on what are the working conditions really like in a country that has a high informal sector, this is a difficult population to find, and one that has very precarious work and is often at great risk for injury and illness. The study's being designed to be a cross-sectional survey based on the European Union. We have a team of experts from Spain, Latin America, University of Texas, who've worked in this field and in survey design for some time. There are a couple things that became apparent early on in our negotiation, and this group of collaborators, of whom I'm proud to be able to call myself a member, we've known each other and worked together very closely for a number of years. One of the first things that became apparent is Central America is not a union. And the European Union has structure to what is the union and what isn't the union, but it has purview, it has access, it has domain, if you will. And in Guatemala, the interests are different than they are in Panama, and than they are in Nicaragua, and than they are in Costa Rica. And so we had to spend our first workshop sort of negotiating all of that. Because we wanted country-specific data that was going to be useful to the country, but we also wanted comparison data, because it's really in the aggregate that this becomes economically, a substantial region in terms of the contributions, and NAFTA and CAFTA were going on, and so how could all of this kind of play into that? So we had to negotiate, was each country going to be able to have its own questionnaire, which of course what everybody wanted. They wanted to make the questionnaire 3 times as long and different in every place. And so we had to kind of, start there and work our way back down to what are the real study objectives and can we all buy into them. This is also one of those times as a researcher where it's like so painful to give up on, but I would really like to know this too. When that's not the objective of the study, but when am I ever going to have access to this population again, right? And that's where in really good survey research, we do this little matrix, right, of the items and the objectives to make sure that every item we're asking lines up with an objective. And if you have an objective whose cell is blank in that matrix, then you're not asking the questions you need to answer that objective. And if you have a bunch of questions that don't fit into any of your objectives, you got to change one or the other. So there was a process of negotiation among the researchers to start with. One of the things that came out of that process was that we agreed that the best way to proceed would be with a professional survey research firm. And I've mentioned before, there's some regions of the world where household surveys, population-based surveys are common. They're understood and they're acceptable. And polling, we contracted with a firm that is headquartered in San Jose, but they have offices across Central America. They can operationalize, mobilize data collectors almost instantaneously. And they were able to provide the continuity that we were looking at, because one of the other things that became apparent in negotiating this survey was, what do you think the inter-rater reliability issues are going to be when we have data collected by one group of volunteers in Panama and another group of researchers in Guatemala and then somebody else in El Salvador? We had to find some way to try to minimize the error that could be introduced by those random or systematic influences based on totally different researchers and methodology. So it doesn't necessarily have to be the same person, and in fact this firm has 2 teams. One team does Southern Central America and one team does Northern Central America, but they're all trained together and they all work for the same company and they've worked together for some time. So that was a very important aha for us. And so once we as a group put together the questionnaire, we then gave it to the survey firm. And they then did focus groups in all the countries to figure out the modismos, how do they understand this in Panama, it doesn't make sense in Guatemala. We also had to make some, and this is another way in which the cultural adaptation of a questionnaire can be influenced by the realities of the country. Guatemala, 35 Indian dialects? We're doing a sample of 2,000 people. Sorry, we're doing it in Spanish. So, as we went down the road of developing this survey, we had to make some important decisions that were going to have consequences for the kind of data, for the representativeness, and each one of these was another negotiation with the Guatemalan researchers and the Panamanian researchers. But we were able to develop a questionnaire and then get the feedback from the research firm. And the research firm actually recommended that these be household surveys because, you know, workers, employers are not going to be happy to have a bunch of researchers come into imagine walking into the maquilas and outside of León, Nicaragua, and start asking a bunch of questions about, gee, what are the conditions here? You know, are they sanitary? Are they safe? Do you like it? Do you get a lot of breaks? Let's look at the ergonomic issues. So we realized that they had to be household surveys. And that brings in a whole nother set of issues about the time of day, when is it safe. There's now a growing prevalence of gated communities in Latin America and Central America, and so those communities are harder to access. So a number of other sampling issues that are beyond the purview of this talk, but it's been an interesting process. All of that to say that we agreed that the survey would be an interviewer administered survey in all settings. So we've done the pilot. We did a pilot. It was really a feasibility study, not a pilot intended to produce any kind of meaningful statistical analysis, to try and see whether we could in fact not only access, but beforehand identify informal and formal sector workers. And the series of screening questions that we had to come up with to try and define formal and informal work. You can't just go up to somebody who works on the street corner and say, are you an informal laborer? There's a series of questions that you have to go through to kind of set the scene and then use that as your screening criteria for they're in or they're out. We wanted an equal number of men and women, and we wanted an equal number of urban, rural, and we wanted an equal number of formal, informal. So we've finished the pilot now in all countries, and actually this group of researchers has now secured funding from Social Security Administration in Spain to do the full-blown large study in Central America. It's going to be very exciting. The Spanish was, so the lessons learned, the Spanish was modified in each country. Response categories were not universally understood, and this is the example that I mentioned earlier on, where some of the questions of this, we had a Likert scale where we asked people, you know, how frequently do you do something? Well, the frequency with which I do whatever is normed by the culture I'm in. When I understand a lot and a little, or I understand it in terms of more than normal or more than usual, normal is a result of the culture that I'm in. So we found in the pilot that these response categories were not universally understood. We were able to identify the feasibility or test the feasibility of identifying formal and informal sector workers, and also got some insight into the best approach into people, finding people at home. What days of the week could you do the study? Obviously, you're not going to have interviewers going into who knows what kind of barrio at 9 o'clock at night on a Friday, but if you only go during the day, when do workers work? A lot of them work during the day, so we had to find different ways of trying to capture these different populations. We found that the duration of the study, the survey varied across countries with almost a 12-minute difference between how long it took in most countries. And then in Costa Rica and Panama, could be a result of who wants to talk more. We're not sure about that. But that was an indication of where some of the different issues or suggestions came up. We got some really good suggestions. In El Salvador, there are a number of questions in this questionnaire that have multiple options for answers. And in El Salvador, they suggested having a pre-printed card of options, so you could hand them the card because it's interviewer-based, it's hard to remember a list of 10 or more items. So we got that suggestion out of El Salvador. Nicaragua and Panama is where the respondents didn't have the same understanding of frequency being compared to more or less than normal, and suggested the changes to everybody seemed to understand, do I consider it to be often, sometimes, seldom, never. Now what we give up in that is the precision that we might have been able to glean from a more precise answer, but making it into broader categories of often. Well, what's often to you is probably maybe different than often to me. So we lose some of that, but gave that up to be able to get the questions answered. Ideas of shifts and work and what the normal shifts are also varies across countries. And so now that we have this pilot data, we'll go back and we'll make these modifications, or we'll adjudicate them. We'll get together as a group and we'll look at each of the items that need to be decided upon and make some decisions about how we go forward with that survey. It also gave us a lot of insight into refusals and how many people weren't at home. There were a large number of houses that were empty. So when we go to do our full sample, if we want 2,000 responses in each country, we're probably going to have to add quite a few to that number to be able to get 2,000 usable surveys in each country. Any questions about, yes, ma'am?
What incentives were provided for taking?
None. Nope. They weren't, we didn't give them a token of any kind. We explained the survey and what it's to be, what the purposes are. Our plan is that this data becomes country data as well as data that researchers can look at. So I suppose the buy-in would be to get people to help explain their working conditions, and so that there can be a better understanding of the protections or other interventions that might be needed to help them.
And one more question. Did you put a limit on age groups?
Yeah, 18 and older. So adult working population. And your question of incentives makes me think about how many people we had who either refused to answer it at all or bailed out after they started. And I don't think there was anybody who stopped, who got halfway through the 30 minutes and said, this is taking too long, I'm not going to do this. But relatively speaking, I don't remember the number offhand in the pilot, but there were very few actual deliberate refusals. There were a lot of people who weren't home, and there were a lot of people who were on their way to work when it was a very inconvenient time, which may have been a way of saying I'm refusing, but there were very few people who, after the survey was explained to them, they specifically said, no, I'm not going to answer that question. That survey.
Did that vary much across cultures?
It was, I should have brought the table with me, and I'm trying to remember. It was different across countries. And I want to say that there were more refusals in Panama, but I could get that data to you. It might be interesting if you're working in different cultures. But there was and that may be reflective of some cultural norm around answering survey questions. There may be in some of these countries a cultural norm around, okay, you're a person that looks to have some authority, you have a badge, you've identified yourself, you're saying this is important, I'm going to answer your questions because you've told me that. So there was some variation. As I mentioned, the samples, we surveyed 24 people in each country. This was the number that the survey firm recommended. And we asked them why 24, and we were expecting some, very sophisticated statistical rationale, and they said, because it's very easy to divide. You can divide anything into 24, you can divide it by 2, you get 12, So that the small numbers don't really allow us to look at any kind of statistical significance of variation, but there was, in fact, in those small samples, higher refusal rates in some countries than others. Questions? Okay, yes?
Did you have to go through multiple IRBs to do?
We did. We went through the University of Texas, which was the financial funnel for the money, and IRB, and we went through the IRB of Saltra being the network of the 6 universities, and that really helped us because we were concerned that we would have to go through the 6 IRBs of the 6 countries, but Saltra is a legitimate, functioning organizational structure that uses the IRB in Costa Rica. So it was looked at by a U.S. IRB and a Central American IRB.
Did they want to see the translation in each country?
They wanted to, well, they got the English and Spanish version of the questionnaire. They were very interested in asking us later on they wanted to know how long it took, because they didn't believe us when we said we thought it would take about 30 minutes when they saw the questionnaire. They didn't ask for the modifying, the letter probably says, assuming that there's no substantial change made in the meaning of the question, but they had both the English and the Spanish questionnaire to start with. Yes?
Could you try, if I was trying to do a good job translating a survey, can you try and summarize the steps that I should go through to do that?
And you're starting with?
Starting with an English version.
Okay, into Spanish. Into what kind of population?
El Paso.
El Paso? Well, like adult, children,
Adults.
workers, non-workers. What's the study?
Parents.
Parents?
Yeah.
Okay. And where are you going to access them?
Mostly at health centers.
Okay. And you want to find out about their children?
I want to find out about parenting stress and social support.
Mm-hmm. Okay, great. I'd start with some focus groups with parents, and I'd just start talking about those subjects. I'd design a couple focus groups that can help you really clarify those concepts. And a great guide for that will be the key variables of your English survey. So your English survey has, 6 key constructs or whatever. Talk to the parents about how do they understand those constructs. Do they exist? What provokes it? How do they manage it? Do they know anybody who has it? What happens to people who have a lot of stress? Do you think it's a bad thing, a good thing? Is it inevitable? Those kinds of things. I try and tease out sort of how do they understand those key constructs, and then do the translation, the forward and the back. And then I would do some cognitive interviews with people who represent or can be good surrogates for that population. You want to be careful that you don't end up spending a lot of time talking to the population that you're going to then survey, because you've already spent this focus group time with people talking about stress, and they sort of have a heads up about what you're asking them, right? So they would have an opportunity to kind of formulate the right answer. So then I would do the cognitive interviews, and it's a process where you have somebody read the question. It helps you get a handle on the literacy level. whether you've translated it at a level that's pretty well understood across the different mix of people you might have in your cognitive testing process. So you have them read it to you, have them, and then ask them how they understand that question. What do they think you're asking them? And then have them answer it. And that gives you an idea of what your range of responses needs to be. And it also gives you some insight into the level of measurement that's going to be the easiest for them to respond to, right? Now, that may not be the level of measurement you need to do your statistical testing, but that will help you figure out how you might need to ask the question or the range of responses that you may need to provide. And then if you can do a pilot, I'd do a pilot. Okay? Anything else? Okay, well, thank you very much.